Welcome to this video on medical ethics, where we will be discussing some of the most important ethical issues faced by medical professions today. In today's world, medicine has made tremendous progress in diagnosing and treating diseases. However, along with the progress comes complex ethical issues that need to be addressed by medical professions. Medical ethics is the discipline that deals with moral principles and values that guide medical professionals in their practice. The first ethical principle in medicine is respect for patient autonomy. This means that patients have the right to make their own decisions about their healthcare. Before any medical procedure or treatment is administered, patients must be fully informed of their risks and benefits involved, and they must give their consent freely and voluntarily. Take this as an example. A patient is diagnosed with a serious illness and is presented with two treatment options, one of which has a higher chance of success but carries more risks. The doctor explains the pros and cons of each of the options and allows the patient to make an informed decision based on their personal values and preferences. The second ethical principle is beneficence. This means that medical professionals must act in the best interests of their patients and strive to promote their well-being. However, sometimes medical treatments can be painful or uncomfortable. In these cases, medical professionals must balance the benefit of treatment against the potential harm it may cause. Take this example of beneficence. A patient with chronic pain is prescribed opioid pain medication, but the doctor is aware of the potential for addiction and overdose. The doctor monitors the patient closely and gradually reduces the dosage over time to prevent harm while providing pain relief. The third ethical principle is non-maleficence. This means that medical professionals must do no harm to their patients. This principle requires that medical professions refrain from performing unnecessary or harmful procedures, and they must be mindful of the potential risk involved in the treatment they administer. Take this example for non-maleficence. A doctor is considering a risky surgical procedure for a patient, but after reviewing the patient's medical history and consulting with colleagues, the doctor decides against it because of the potential risks outweighing the potential benefits. The final ethical principle is justice. This means that medical professionals must treat all patients equally and fairly without any discrimination. Medical professionals must respect the dignity and worth of every patient they treat, regardless of their social, economic, or cultural background. Take this example for justice. A patient arrives at an emergency room with a life-threatening condition, but does not have any health insurance. The doctor treats the patient just as they would any other patient and does not discriminate based on the patient's ability to pay or socioeconomic status. The hospital also has policies in place to provide financial assistance to patients in need. In conclusion, medical ethics is a critical aspect of modern medicine. Medical professionals must be guided by their ethical principles to ensure that they provide the best care for their patients. Thank you for watching this video on medical ethics. We hope this video has given you a better understanding of the ethical principles that guide the medical professions in their practice.